This visible hole is caused by tooth decay. But after examination, it may be repaired with a tooth-colored filling. The dentist evaluates the depth of the cavity before selecting the most appropriate treatment. In this example, the decay has reached the dentin, but has not affected the tooth inner nerve. Only the damaged tooth structure is carefully removed while preserving healthy enamel. The remaining decayed tissue is removed to create a clean foundation for the restoration. The tooth is rinsed and prepared before the bonding procedure begins. A bonding agent helps the composite filling securely attach to the tooth. Tooth-colored composite is added in layers to rebuild the missing tooth structure. Each layer is hardened with a curing light for long-lasting strength. The new filling is carefully shaped and polished for a natural appearance and comfortable bite. The bite is checked to ensure the restored tooth functions comfortably. Brushing twice daily, cleaning between your teeth, and regular dental checkups help reduce future cavities. This video is educational and not personal medical advice.